Some of our most popular breeds in the UK are the brachycephalics, those flat-faced dogs like pugs, Frenchies and bulldogs. But these breeds are also the most debated and the most divisive, with vets and animal welfare campaigners regularly moving to ban them altogether. A recent study claimed that the average age of a French bulldog is now only 4.5 years. Now, I really want to get under the skin of this debate, so who better to talk to than Dr Jane Ladlow, who is the Director of Research at Cambridge University. Jane is a specialist in small animal surgery who has been researching some of these brachycephalic breeds for nearly 20 years. Her research has led to groundbreaking techniques on how to assess these dogs, but also some amazing surgeries that can help to treat them. Jane's work has led to the introduction of health schemes in these breeds, which are used in many countries around the world. I'm going to be asking Jane about these breeds, the health issues they face, but most importantly, if there is a way we can make them healthier to live longer, happier lives. Jane, welcome to the consult room.
Thank you very much, Paul. It's a pleasure to be here.
So, Jane, I have touched on some of the breeds we're talking about, but what do we mean by brachycephalic? Because it's not a term that everybody understands, is it?
No, it isn't. And I think the thing to focus on, it's a short and wide head. So it's not just the length of the nose, it's also the actual length of the skull, the calvarium. And many of these dogs have also got a wider head as well. So you can't just focus on one area. You've got to look at the whole conformation of the head. And the reason we struggle with these breeds is because sometimes that conformational aspects are linked to areas in the airway that are either obstructed or restricted. So many of these dogs have breathing obstruction, breathing difficulties.
So we're going to dive into some of those really specific issues in a second, but I think I just wanted to say that you are definitely my go-to expert on this area, and I know we've kind of done quite a few features on TV and things before, and you've dedicated much of your professional career to these dogs. Why?
To be honest, it was a bit of an accident, you know. I was a new European diplomat in 2003. And I was working at a really lovely place called the Animal Health Trust, and we were doing clinics and research. And I operated on a few bulldogs, and I saw them back and looked at them, and I thought, well, this is interesting, because when you look at the old papers, they were meant to do brilliantly after surgery. So they were all excellent to good. And I thought, well, I'm not sure this is excellent. You know, it's okay. It's better than it was, but it's not excellent. And I went back and looked at the papers, and the way they had checked their surgeries is they had sent out questionnaires, or they'd phoned people and asked them how the dogs were. Now, one of the major issues we have with the airway obstruction is that people don't recognize it. So if you ask somebody who doesn't recognize the symptoms, how's it doing? They're going to say fine. And I didn't think my guys were doing quite so well. So I thought, well, we'll just measure this. We'll measure the breathing function. And had I have known how difficult it was going to be and how many years it was going to take me, I don't think I'd have done that. But we did it.
So it was a bit of an interesting that led you down a very long garden path.
Exactly. Yeah.
Well, you know, we'll get into some of the work that you've done, because I remember some of my early veterinary conferences and things like that, and you talking about these breeds, and you're doing some like really amazing things with, are they called hyperbaric chambers? Are they?
Yeah, exactly. It's a plasmographic chamber. Yes.
Yeah. Just explain what that was, because I remember looking at it thinking, wow, this is really fancy.
So the initial issue we had was, how do you define the disease? And the breeders said their dogs were fine, and I thought the dogs were not fine. And you've got to come out with some kind of objective assessment. So I played for a whole year. I made a mask for these dogs. So I had a dog asleep, and I modelled its face, and I made this lovely clear mask, put it on him when he was awake, and he hit the ceiling. So I thought, well, that one's out. And then we tried these bands that you put around the chest and the abdomen to try and measure respiration. But bulldogs are quite barrel chested, and they just slid off. So I kind of was left with this whole body. It's called a whole body barometric plasmograph, and it's a clear big chamber. So it looks a bit like a fishbowl, and you pop the dogs in, and it's got an airflow across it. And then you've got pressure transducers in the top of it, and you can measure your respiratory flow over time. So we get measurements of how much air is being breathed in and out, and also the respiratory time for each dog. And by using that, then we could work out respiratory measurements, and we actually turn that into a numerical score of how obstructed the dogs were over about 5 or 6 years.
That's amazing. But you've turned that work into something a bit more practical now, haven't you? Yeah.
We have. So the plasmography chamber is really lovely. And I was playing with it yesterday afternoon. It is my happy place. It's a place where I'm happy with that chamber. I'm a very sad person. But actually being realistic, the kit itself costs about £35,000.
Wow.
But the important thing is you need someone to run it, So yesterday afternoon, I spent an hour and a half checking one of my patients. But you need a nurse at least or someone like that to run it. It can take an hour and a half to get these tests done. And that is absolutely not practical in a general veterinary practice or even in most referral centres. The way we train, so if you think about the plasmography chamber, what you've got is a load of data that you feed into that chamber, feed in with the software to get your result back. And how we were training our data was on our clinical assessment. And I suddenly sat back and thought, it's interesting because I focused on that. We know that this works. But what I hadn't looked at was what we were using to train it, which was a really straightforward, very simple clinical assessment that you just need a stethoscope for. And I've been waiting for the genetics, and the genetics are very complex. And we are moving forward with the genetics, and we will get estimated breeding values at some stage. But I thought, well, rather than waiting 3 or 4 years to get this, why don't we do something now? Because you could see all these dogs that were affected around us. So we put that out as a respiratory functional grading scheme. And actually, it's for many different things. So we use it for the breeders, so the breeders can see which dogs they should breed with. But you can also use it as a vet to see which dogs need surgery. You can monitor the airway of the dog throughout its life. If the pugs get a little bit fat, you can monitor how they're doing when you diet them. So, and also if you're operating on these dogs and you don't have my fancy chamber, it's also a way to audit your surgical results. So, I kind of came up with it for the breeders, but I'm teaching a lot of vets how to do this now because it's so simple. And I think it's really useful to be able to talk the same language, measure something, and then define it. Okay, and that's pretty much what we are now.
So in summary of that, then, you had this really amazing fancy piece of kit that gave you a really objective view on how well these dogs are breathing. But in the process that you've gone through, you've managed to simplify this into something that any vet can do anywhere, and we can now kind of take that knowledge and insight that you've learned, to really help more dogs across the country and the world.
Yeah, I think that's correct. And when I started this, you looked in the textbooks, we all knew what BOAS was, brachycephalic obstructive airway syndrome. But it was really interesting, and there's lots of areas in veterinary medicine that are like this. We know what it is, but it's not defined anywhere. So everyone talked about noisy breathing, but many people didn't react to noise when they heard these dogs making it. So what is noisy breathing? How much is too noisy? And the breeders are going, well, that's normal for the breed, which is absolute rubbish. I don't accept that at all. So once you've put in criteria and defined something, then you can measure it.
So we've got some really good understanding of the science for how you assess these dogs now. But let's just take a step back a second, because from my observations, and I've got to be honest, there isn't, generally a month that goes by where there isn't some noise in the veterinary or animal welfare media about these breeds of dogs. But from my perspective, and I'm going to be very simplistic here, you've got two kind of sides of this. You've got, animal welfare advocates and, vets, I'll probably group them together, who absolutely love dogs and really want to improve the welfare of dogs. And then you've got, on the other side of the debate, you've got people that choose to own and perhaps breed these dogs who also love dogs. But the two groups don't seem to be able to come together, or in the media that I've seen certainly agree. Could you summarize the position or the issues on both sides of this for me?
I think you've done a pretty good job there, Paul, to be honest. So you have a lot of vets and animal welfare people that are having to treat these dogs. And you see dogs coming into your practice who are in severe distress. Oh, the other thing that's frustrating, you see dogs coming in that are in severe distress and the owners don't even notice. I saw a dog recently and the dog was running out and then collapsing and the owners thought it was funny. And you think, on what level is that funny? So that's a massive frustration, is that when you see dogs that are obviously severely affected, the owners don't react to it. Okay, so that I struggle with that. And when you're operating on them and you can see that you're operating on a disease which is essentially man-made, it's really challenging. Okay, so I have a lot of sympathy, because if you're working on them and you can see how they're suffering, it really isn't pleasant. On the other side, we've got the owners and the breeders, many of who absolutely adore these dogs, and the characters are often really lovely. And actually, the thing that I think that sometimes the vets don't see is that when you look at some of the breeders' dogs, there are some really good dogs out there. And I guess I was super lucky, because if I'd have started this research 20 years ago and every single dog was affected, I wouldn't be talking to you now. We had nowhere to go. Okay. So the fact that we've got good dogs in each of the breeds, about half of them are pretty good, then there is room to move. You know, we can get away from those really horrendously affected dogs and move towards a healthier dog. So there is space to move. But it's also interesting. Everyone reacts to the affected dogs. Okay, so I was working somewhere recently, and we had a 7-year-old bulldog came in. A really nice dog. It came in for a swelling over the side of its face. By the time it came to see us, the swelling had resolved. Okay, so I'm sitting there with the students, and I actually exercise it because I'm a bit of a geek and I like to know what the airway's doing. So this dog is a grade 0 bulldog at 7 years of age. And I didn't say much to the students. I just evaluated it, did a full health check. And then when the dog left the room, I said to the owners, the students, what did you notice? And they said, oh, swelling's gone. You know, they could tell me all about the things, but not one of them pointed out that I'd just had a 7-year-old bulldog in with absolutely no airway disease at all. So if you focused on the disease ones, sometimes you miss the good ones. Okay. And likewise, the breeders that are breeding decent dogs don't understand sometimes why the vets are so antagonistic, because they're not seeing always the really severely affected ones. So both sides are not always seeing a little bit of what's on each other's side. Does that make sense? If we could all see the whole picture, it'd be much easier. You know?
I think that's a really good point. And I've worked in the veterinary charity sector for, nearly 20 years now. And it's really interesting working with organizations who, a lot of them have a kind of a blanket ban on any sort of media representation of these breeds. And it's like, no, we can't use images of these. Now, do you think on that basis that's helpful or unhelpful? Because I always think there is a good version of this breed that maybe we should be showing a bit more. What do you think?
So that is super interesting, because I'm part of the Brachycephalic working group. We have advocated for reduction in advertising of the flat-faced dogs, and I think removing them from the public domain a little bit is sensible. However, if you look on social media, they're everywhere. And some of the dogs we see on social media are the worst kind of these breeds. So we're seeing dogs with massive ropes. We're seeing dogs that are hugely thickened and wrinkled, and if that's the impression people are getting of a bulldog, then maybe they're going to accept that. Whereas if people could see actually some of the bulldogs that I see and some of the pugs I see, then I think they may change their ideas. So I think that's really interesting. At the moment, it's this blanket, no, you mustn't advertise these, but they're everywhere. And I think perhaps we should be advertising the right type of those dogs. So I agree with that, actually, Paul.
So, we have done some work together at Crufts, which is obviously quite controversial in itself. I'm there to really present and promote health and welfare features of dogs to wider audiences. So I'm very clear on what my role is as one of the presenters at Crufts. But, you're there as well year after year, working alongside these show rings and working with breeders and owners, doing some great work and, doing free respiratory function grading tests. And do you come under fire from people in the profession for, even engaging with those audiences? Because I certainly have had some challenging conversations with colleagues about, my role at Crufts.
Do you know, Paul, that's a really interesting question, because at the moment I'm kind of left alone. I walk a very difficult tightrope between talking to the breeders and engaging with the breeders, and also, trying to help the vets and giving the vets tools to use in clinical practice. And it is a tricky place to be. I think I'm in the right space. Okay, so I'm actually really happy with where I've positioned myself. And the other thing is, I can talk to the breeders now. And I went to the FCI conference in Mexico in the autumn, and I had all the kennel clubs there, and I put up video after video of affected dogs and bits of larynx that were collapsing, and palates that were too long, and they took it, right? So I've managed to get myself into a position, having proven the existence of the disease, the fact this is not right, the fact that's too noisy, where I can stand up and say the evidence is saying this, and I can get into areas that I wouldn't get into if I just stood back and say, all your dogs are terrible. And actually, all the dogs are not terrible. If you give me a well-bred, grade 0 French bulldog or pug or bulldog, then I might choose it over a Labrador that's got elbow dysplasia or hip dysplasia, if I'm being honest. Okay, so it's a tricky area to be, and I sympathise with you because I think you do a great job actually as well. But I think unless you are communicating with all parties, you're not going to go anywhere.
I completely agree with that. And, you know, my mantra is always, you know, you've got to be sat around the table to have the conversation. Yeah. But, you know, to gain the trust of people takes a very long time. And it's, you know, I just, you know, wanted to just say how brilliant it is that you can stand in front of those people and speak with authority, evidence, but also trust and respect, because you are, you know, you spent that time building those relationships. I do find sometimes that, you know, vets in their remit as educators, we sometimes sit on the sidelines and wag fingers. And I can say that because, you know, I'm part of the profession and I've been part of that activity myself. But it's not always engaging, is it? That means of communication.
No, you know, and I do get comments sometimes from people in the welfare area. And I guess my comment to them is, well, what are you doing, right? I'm going to loads of dog shows. I'm talking everywhere. I've got a health scheme. It's gone international. You know, I am spending a huge amount of time and effort moving things forward, providing solutions. What's your solution? Because if your solution is to ban the breeds, then you've got years before you get there. And in the meantime, we're just going to sit back and watch this happen. So I guess I'm a very simplistic person, and I'm a bit of a solution person. So I see a problem, what's the solution, you know, and that's kind of the way I work. So I guess that's my answer. You know, all you people that are going to shout it, and there's loads of people now doing social media comments on how awful these dogs are. And I think, well, yeah, helpful, but why don't you actually do something? It's like, is that a bit naughty? Possibly. So.
Yeah, and yeah, no, I completely agree with you. But it's a lot easier to sit on the sidelines and make comments than actually go into a face-to-face conversation with somebody, isn't it? Where you know, potentially think your views might not agree. But so just going back to the rise in popularity of these dogs, why are they so popular? Why are people drawn to them?
So that's a really interesting question, because when I started the research, it was 2003, and we saw English bulldogs, which are just bulldogs, and we saw, you know, a few pugs. We didn't see many French bulldogs, and then they went exponential, you know. And I think the last year we had a little bit of a drop from 2020, but I think we still had 45,000 registered French bulldogs, and that's only about 20% of the population, we think, in the UK per year. So they are enormously popular. People like the way they look. Okay, so they look quite like a human child. They've got the large eyes. They also maintain eye contact for longer than many other dogs, which means that then you get a release of prolactin, and that stimulates your feel-good factor. They are really funny. They're funny, nice dogs to have around, you know. So I understand why people find them appealing and why they like them. Bulldogs, I mean, there's the whole thing about the English bulldog, isn't there? And it's it's kind of a bit of a kind of a symbol of our country, and they like, you know, these big set bulldogs. And you think, and pugs are just delightful characters. I don't think I've met a nasty pug, right? So I understand why they like them, but a lot of it is about the way they look, isn't it? Let's be honest. And unfortunately, that does create issues.
That's really interesting. So I'd heard about the fact that there is something, you know, with them having the big eyes that make us think that they look a bit like little people or human babies, and there's that. But I've never heard that eye contact piece. So just tell me that. So they maintain eye contact for longer than other breeds. And then that releases the hormone prolactin. What does that do to us, that hormone? So,
bless Paul, you won't know this, but when you are breastfeeding, it causes your milk to release. Okay, so it's a happy bonding enzyme, like hormone. Sorry about that.
Wow.
But it's your happy bonding hormone. Okay, and I think it gives you a very happy feeling when you're looking at that dog. Okay, and you bond. You know?
Does that have the same? Is it the same effect in men and women then? Human men and women?
Yes, I think it does actually. Yeah.
That's
and you know, it's interesting because you can pick your typical French bulldog breeder. They're often younger, they're often childless, and those dogs are their children, right? And you have to be ever so careful how you talk about them, because it's somebody saying your child is, you know, deformed, or the language has to be very careful about how you talk about what is such an important part of their family. You know?
That's amazing. I mean, the only eye contact, well, I often get eye contact from my dog, Rodney, who's not a brachycephalic, but it just made me think of how he looks at me. I get a lot of side eye from him. I got side eye from him this morning when I took a chicken bone out of his mouth that he'd picked up off the street. And that was about, I'm not sure I had prolactin release at that, but so that's really interesting. So there's actually a really scientific reason that people are drawn to these pets.
Yeah. And the other thing, I once had an owner say, and this is on a Kennel Club film we did, and I thought, isn't that interesting? She was an older lady and she had an affected pug. And she said, I almost liked the fact that it was ill because I felt it needed me. And I thought, isn't that interesting? She was quite perceptive. That dog needed to be looked after carefully. It needed babying in her eyes. It needed that extra care, which she actually quite liked. And then actually she had enough nous to stand back and say, this is wrong, right? We shouldn't be doing this. But isn't that perceptive that she actually quite liked the fact she felt the dog, needed her to look after it? Right?
That is so fascinating, and I've seen that so many times in a consult. And you often see it actually when people go and buy a puppy and pick the runt.
No.
I always used to think. I'm so practical the way my brain thinks. I always think, you wouldn't go and buy a car and buy the one that looked like it was busted in the corner, that didn't work properly, and I know that's a very, very practical way to look at it. But I used to get so frustrated with people who went, oh, this one looked really sad and sorry for itself. And I know that dog, and it's just all the heartstrings get pulled, and what is going to happen to it if somebody doesn't take it. But I just think, especially when people have gone to a full litter and bypassed all the healthy, confident pups that are bouncing around, I want that one. That one's going to cost me a fortune. Let's take that one. I mean, and I know that's a very, very practical way to look at it. But okay, do they make good pets though?
Well, I mean, yes, they can do if you get the right dog, so it's interesting. You were talking about the lifespan of French bulldogs being 4.5. Well, I recently graded one that I graded when it was 2 years old, and he's now 10 and he's still grade 0. Okay. And that dog's running around, happy, great life. But actually, if you have a French bulldog that has really bad airway disease, and then many of the dogs that have got really bad airway disease are also looking now like they are more predisposed to the spinal issues, they get disc disease, so if you bounce from an airway problem into a back problem, maybe you've got some skin folds that you've got to clean daily as well. There's a lot of involvement and there's a lot of cost. So if you get the right dog, they can be great pets. But if you get one of the unhealthy ones, you are looking at, thousands of pounds and quite a lot of distress, I think.
And just to put this in context, as we sit here today, I've got a friend who has a Frenchie who has had spinal surgery yesterday for a cervical disc problem, and they went for referral, and the costs of that were somewhere between £7,000 and £10,000, including the MRI scans and the surgery and the hospitalisation and treatment. So, I mean, that is to me a huge amount of money. And I just sit here today and think I wouldn't, even with an insurance up to the max. I'm really struggling to, I wouldn't personally be able to afford it. So it is a very real and financially crippling problem, isn't it?
Exactly, so, and it's awful to put people under that pressure of, do you treat your dog, do you euthanize it? It's a really horrible situation to be in. So I think people have to do their homework before they buy these dogs if they want those breeds. Okay.
So they attract a huge amount of attention due to health issues. So we've mentioned a few spinal problems, you've mentioned, the breathing issues, but could you kind of just give me a bit of a summary of the main health issues these dogs have? Yeah,
sure. So breathing, we've talked about them having breathing obstruction. Then often they have eye issues. So you can get exposure of the corneas, you can get ulceration of the corneas, you can have these big nasal folds, which also cause irritation of the corneas. The bulldogs can get a prolapse of their third eyelid or third eyelid gland, which is called the cherry eye. We also have sometimes eyelids curling in on the bulldogs as well. And then, unfortunately, in some of the extreme brackies like the Pekingese and the pugs, you can also get prolapse of the eyeball, which is such a distressing condition for owners and for dogs. So there's a whole issue with eye conformation that's going on. We can get some tooth issues as well. So because you don't have a what we call a scissor bite, you don't have a nice alignment of the upper and lower teeth, and you can get some periodontal disease. And then we go back, we've talked about spinal issues. You also get gastrointestinal issues related to the airways, so we can get reflux that can also then make the airway worse, actually, because if you get reflux of stomach content into the laryngeal area and the pharyngeal area, then you get acid in that area, which kind of swells everything up as well. And then when we look at the tails, then you can get the inverted tails in the bull breeds. And those are super unpleasant because they have really deep folds and can cause infection, and that's very painful. So big issues there. And then the other thing that we can sometimes see is problems giving birth. So cesareans, Boston Terriers have a very high rate of cesareans. And if you put it all together, it's quite an unpleasant picture. Now, one thing that's quite reassuring to me is there was a nice insurance data study that came out this year, and it did show that the dogs that have got the worst airways are far more likely to get disc disease. So one thing that I have been attacked about is I've just looked at the breathing, and I would answer, well, that's a really big area and I've done quite well on it, right? But why didn't you look at the whole dog? Well, because, I've got children and parents and jobs to do, but it's really nice to start to see that in some of these areas they are linking up, and if you've got a dog with really poor conformation, it will affect many areas. And some of the risk factors for the BOAS that we've teased out, like having the shorter necks and having the wider heads, are almost certainly going to contribute to having problems giving birth and also to having disc disease.
Wow, that's really interesting. So there was a lot of conditions there. And as you were talking through them, it really did feel like it was a complete nose to tail. Like there was, and as you went down the body. Yeah. Wow. Okay. Yeah. However, with all that said, you said earlier that actually in the population of these breeds we have in the UK, half of these dogs are actually quite healthy. Now, that's not the narrative that I hear. I hear that all of these dogs are really unhealthy and they're getting more and more problematic with more and more health issues. So can we go back to what you said before? Half of them are healthy. Is that improving? What's the situation?
So when I say half of them healthy, I guess that's from an airway point of view. So I've got to be honest about that. But it's interesting. So we was always told that BOAS is progressive. So, it starts when they are 1 or 2 and then it gets worse. And, if you've got a 1-year-old dog at the age of 1, it'll be, 3 severely affected when it's old. And we've started retesting them. And actually that isn't quite correct. So I retested a 10-year-old bulldog recently that was 2 at the age of 1, and it was a grade 2 at the age of 10, and I was super surprised. Okay, and I thought, isn't that interesting? So I think what happens is the dogs with the really bad airways present early and then get worse, but I think other dogs are a little bit more stable, and some of the 0s and 1s that we're seeing now, they are holding those grades throughout their life. Now we need to keep retesting these dogs. We need to make sure that data is a big enough data set we can analyze it properly and be certain about that. But I don't think there's this idea that every single dog is going to end up with obstructed breathing, and I'm seeing a refreshing number of older dogs that look reasonably decent. Okay, now the disc disease, I don't think we have the numbers on that yet, and I know many dogs have got vertebral abnormalities, so what we need to know is how many of those dogs actually do have disc disease throughout their life, and that that will be hopefully teased out in the next few years. So it's difficult because how many of these dogs actually have a decent quality of life when they're older? We don't have an answer yet. But the RFG, because we ask these dogs to be retested every 2 years, hopefully over the next 10 years, we will get some decent data on what the dogs are doing when they're older. Okay.
And just for clarity, you mentioned a few things there. So if you could just explain what's BOAS, what are the grades of this function test and what they mean, and then just clarify what RFG means as well.
Yeah, that's absolutely fine. So BOAS is a brachycephalic obstructed breathing or brachycephalic obstructive airway syndrome. The RFG is a respiratory functional grading scheme that we brought in, which is how you evaluate the dogs before and after it's a trot, a 3 minute trot at about 4 to 5 miles per hour or 6 to 8 kilometers an hour. So it's not a walk, it's a proper trot. And you listen to the dogs again, and by judging the amount of respiratory effort and also the amount of airway noise, we can then put these dogs into categories. And the grade 0 dogs have got absolutely nothing that we can pick up on their airway. And the grade 3 dogs, severely affected dogs, are really in a very bad way and need veterinary treatment. Okay, so you've got the extremes. And then in the middle, you've got the 1s and the 2s. The 1s we say are clinically unaffected because although there's a very small amount of airway noise that you can only hear with a stethoscope, okay, they don't tend to have clinical signs. The grade 2 dogs, you can hear them without a stethoscope. So this is why I don't think we get many appeals from the breeders, is because it's so obvious when the dogs are affected. You can hear them. If you can hear that dog, it's a grade 2 at least, okay? So it's a really simple scheme. And what we're trying to do now is follow these dogs throughout their ages to see where they move to and how many of the dogs, stay as a grade 2 and how many stay as a grade 1.
Really helpful, thank you. So in terms of, you obviously have focused very much on these breeds throughout your career, and the way that you could reel off those diseases was really, really impressive. But they do get a lot of attention as being the unhealthiest breeds in our domestic dog population. But there are also other breeds that have got a whole host of other problems. So where do you think that's a true statement, that of the breeds of dogs that we currently own in the UK, that they are amongst the unhealthiest? Or can you think of other breeds that you think personally are probably up there as well?
So I think the extreme brachycephalics are probably the most unhealthiest because they have so many areas that can be affected. Okay, so I think that's the issue. You've got so many different areas that can be affected, but there are lots of other breeds with conformation related problems. So, which breed is coming up really popularly now? It's the dachshund. Okay. And the miniature dachshund, a lot of those dogs get disc disease, so you think, great, having had the peak of the Frenchies, now we seem to be choosing another exaggerated dog, which unfortunately has got disease. So I guess what we need to work out, and we need some social science input here, is why do people like exaggerated dogs? What is it about, you've got to have the kind of one that's bald or the one that's fluffy. I mean, what is it about these dogs that people like? And how do we alter perception to actually focus on the health of the dog rather than the look of the dog, rather than the appearance? And that's a really tricky question. And I don't quite know how we do that.
You mentioned before that people are seeing examples of these breeds on social media. What do you think the role is of social media? Is it a problem? Is it influencing people? What's the situation?
I think it's a huge problem. And I remember years ago when we started looking at these dogs and we looked at some of the Facebook sites, and there were dogs with their own Facebook sites and they were getting hundreds of thousands of followers. And it's a huge issue. They dress the dogs up. You see pictures of these dogs sitting up and sleeping and falling over and sleeping, and they think it's funny. And you think, oh, it's heartbreaking, actually. And how you fight that, I'm not quite sure. It's a really difficult area. We did an animation recently, so we kind of did a really beautiful animation with a Cambridge student, which I've tried to float around a little bit because we thought, well, let's try and fight back a little bit with some of the cartoons and some of this kind of stuff. And I think actually we need a little bit more innovation on how we try and influence the social opinion of these dogs.
Really interesting, actually, and it's a thing that I think we struggle sometimes to engage with, especially. I mean, there are a lot of vets and animal welfare advocates that are very active on social media, but it's very easy just to unfollow or block people that you don't agree with. And then the conversation's ended, isn't it? And you find that often in social media, these groups form that are of like-minded people. So, they go down the same route, and it's that groupthink mentality, isn't it? Rather than getting a balanced conversation. So I don't think social media helps that environment, does it?
I don't think it does. And, one of the things I've always thought is, I don't know if you've encountered this with children, but when I had my children, and I didn't want them to do something, if I said, you can't do that, then you could guarantee we were going to fight or they were going to do it. Whereas if I said, well, look, that's not so good, but choose this or this, then you could usually bring them round. And I think it's easier to nudge people. So if you want to really have that breed, okay, you can have that breed, but choose this or this. And I think that's a message we need to get over. If you want to have these dogs, then choose this type of dog and not that type of dog. And by the way, it may come with these issues and these vet bills. So I think it's more about information rather than telling people they can't have them, to be honest.
That's a really important point, and it was going to be exactly my next question. I think we're very trained to say, actually, you shouldn't get these breeds, but actually many people are going to get them anyway. So I'm going to come to you, I'm going to say, right, I'm definitely going to get a French bulldog. What would be your advice?
So my advice would be at the moment to go to an assured breeder from the kennel club. So go to the kennel club. There is an area in the kennel club where you can look at the assured breeders. The assured breeders have done their health testing. And then you want to find assured breeders that have got dogs that have got the RFG scheme registered. So that's the thing you've got to watch out for. Lots of people say their dogs are health tested. And then when you look what they're health tested for some obscure DNA test that doesn't even occur in that breed, okay? Well, let's cut that out. Let's look at the diseases that are really prevalent in that breed, and you test for those diseases, right? As far as I'm concerned, every bulldog, French bulldog and pug that's bred should be assessed with the RFG scheme. So choose your breeder carefully, make sure that they do the correct health tests, not just health tests, but the correct health tests. And then you want to go and look at the dogs yourself before you choose the puppy. And you don't always get to see the stud dog, unfortunately, because many people will have the bitch and not the stud, but you can at least look at the bitch and look at her exercising, looking at her moving around. Don't just, look at her in the corner of the room and think she's cute, actually see the dog out and moving. And then the other thing I always say to people is, if you do get a dog with a problem, then please report it back to the breeder. So one question I always get about the RFG is, well, people could have surgery and go and get them tested. And I think, well, they could actually. A, I don't think surgery usually produces a complete cure anyway. And B, I haven't met many good breeders that actually want to breed diseased puppies. And also having people coming back and saying, well, that puppy you sold me and you said it was really good. Well, I've had to spend this amount of money on it and it was really struggling. It must be hideous. Okay. So when people do buy a dog and it doesn't go well, you must feed that back and tell the breeders, look, this was not a great thing to do. The thing that really upsets me is when you get relatively intelligent people in your consult room and you ask them, where did you buy your dog? And, sheepishly they'll say, oh, well, we found it on the internet. Where exactly did you find it? Oh, we found it on Gumtree. Okay. And where did you pick it up from? Did you see the parents? Oh, no, we got it from a lay-by on the motorway. And you think you're an absolute idiot, So you can avoid problems, but you've got to do your homework. You've got to be ready to wait for your dog, and you've got to actually treat it as if it's going to be with you for the next 10 years and not some disposable piece of clothing that you throw away if it doesn't work.
That's really, really great advice. Okay. But I've already gone and got one of these dogs. I forgot to ask you. I forgot to ask you last month when I went to get one, which, let's face it, that is often the situation, isn't it? People go in and get these dogs without seeking out advice. So I've already got the dog. What steps can I now take to make sure that this dog lives a happy and healthy life?
Fine. Okay. So as a vet, standing there with my vet shoes on and you've got these puppies coming in, a little bit frustrating, but what you can do is introduce a respiratory functional grading scheme when those dogs are young and do not have problems. And you can give them, we have information leaflets on this. You can give the owners the information so that they can then watch the dogs carefully. And if they notice any of the symptoms, they'll come to you earlier rather than later and they'll spot it. The other thing you can do that's super important, particularly in the pug, is to keep your dog in the right body condition score, so to keep them slim, okay? So particularly in the pug, obesity is a massive issue and can easily increase the severity of any breathing disorders by 20 or 30%. So keeping those dogs thin and healthy, well, actually keeping all dogs thin and healthy is super important, but particularly the flat-faced dogs.
Really good advice. So what is your vision of a perfect world? When will your work be done? Or, can we ever have a healthy flat-faced dog?
There's a lot out there, but we've got a huge amount of work to do first. I mean, this is slightly strange because I'm a veterinary surgeon, but I would like to not be operating on so many airways, and I would like to be doing a little bit more general surgery. So I'm a soft tissue surgeon, and I'd happily lose some of my airways because we had healthier dogs coming through. So when we can drop the particularly severely affected dogs out of our population, I think we'll be doing really well. My caveat to that is some of the dogs that we are seeing coming through now are even more exaggerated. Some of the crossbreeds, as in the flat-faced crossbreeds, are really difficult to deal with. And I don't know if you've seen these, Paul, but we have dogs coming over now which are called toad lines. And they're not really designed to be dogs. They're designed to be status symbols. And these poor dogs can barely walk. They can barely move. So it's also how you influence the public to look at it as a dog as a dog that should have healthy exercise, that should be able to run and enjoy its life, and how we need to switch it from being a status symbol or something you play with to being a healthy dog.
To being a dog. Amen to that. Jane, where can people go to get more information?
At the moment, I licensed a scheme with the Kennel Club, and we did that because we wanted to hit the breeders. And the Kennel Club have done a really nice job with this. And there is resource on the Kennel Club site. So if you put Kennel Club and you put up the RFG scheme, then you will get information on what the actual scheme is, looking after these dogs. You can also look at the different breeds on the Kennel Club site, the French Bulldog, the Bulldog and the Pug, and they will tell you the things that you should be looking for. And they'll also tell you some of the health issues. There is also the different breed clubs. So if you look at the French Bulldog Breed Club and the Bulldog Breed Club, they will also have an area there on health and things that you need to look out for. So there are areas where you can get nice resources.
Thank you. That's brilliant. Jane, are you going to Crufts next year?
Almost certainly, yes, Paul.
Well, I will see you by the Bulldog Ring, no doubt.
I look forward to it, yes.
That was a great conversation. And as Jane said there's loads of information out there on the internet. I just punched in respiratory function grading scheme and it brought up the page in the Kennel Club website. Talks about what is the scheme, how to book an assessment, what each grade means, and then some really, really important breeding advice, including how to make those balanced breeding decisions. So I hope you've enjoyed the show today. Please check out our other podcasts at the Consult Room. And we've also launched a series of blogs and YouTube videos. Just look for the Consult Room.